Here's an important SSDI pro tip. Don't assume the Social Security Administration automatically has access to all of your medical records just because you provided some information about your medical conditions. When you apply for SSDI, SSA generally relies on the medical providers you identify to help develop the medical evidence in your claim. That means if you leave out an important doctor, hospital, specialist, clinic, therapist, or other treatment provider, SSA may not know those records exist. And missing records can create an incomplete picture of your medical condition. For example, your primary care records might show that you have chronic back pain, but your pain management records may document injections that provided little relief. An MRI may show significant abnormalities. Physical therapy records may document difficulty standing, walking, bending, or lifting. Or a specialist may have documented symptoms and limitations that aren't described in your other records. Each piece of evidence can help SSA understand the overall severity of your condition and how it affects your ability to work. That's why it's important to make a thorough list of everyone who has treated you for the conditions affecting your ability to work. Include primary care doctors, specialists, hospitals, emergency rooms, urgent care facilities, mental health providers, physical therapists, pain management clinics, imaging centers, and other relevant providers. Try to provide accurate names, addresses, phone numbers, and treatment dates whenever SSA asks for that information. And remember that your medical treatment may continue while your SSDI claim is pending. If you start seeing a new specialist have additional testing, go to the emergency room, undergo surgery, or receive other significant treatment, that information may need to be added to your claim. It's also important not to assume that simply identifying a provider guarantees that every relevant record will ultimately appear in your disability file. Keeping track of your treatment and reviewing whether important medical evidence has been obtained can help reduce the risk of significant gaps in the record. At Disability Advocates Group, we help SSDI claimants with every step of the application and appeals process. If you're thinking about applying for SSDI or would like help with your disability claim, call Disability Advocates Group at 800-78-82095 for a free consultation. You can also use our free SSDI screener at ssdanswers.com to see if you may qualify for benefits. This video provides general information about SSDI. It does not constitute legal advice.